Hi, my name is Miguel Talamo, and I will be presenting about febrile seizures, particularly in children. So first, I wanted to talk about what they are. And typically, these are described as seizures that are brought on about by a steep increase in bodily temperature, aka fever, in otherwise healthy infants and young children. Most of them occur within 24 hours of the child becoming ill, and some of these children present with a seizure prior to spiking in fever. So the important note is that a febrile seizure is not indicative or related to epilepsy in the child. That's why it's distinct from epilepsy. But why does it happen? So the most common hypothesis is that the elevation of temperature itself is sufficient to cause enough dysfunction that it would trigger a seizure, as well as the hypothesis that inflammation, some inflammation factors like cytokines play a role dysregulating the electrical activity of the neurons, which causes a seizure. There was a paper by Dubé et al. Explaining that the fever promoting pyrogen interleukin 1 beta contributes to fever generation, and conversely, fever leads to the synthesis of that same cytokine in the hippocampus. Um, and just a little bit of context: cytokines are these inflammatory factors that I was talking about, which could contribute to the aforementioned dysfunction in the neurological electrical activity that would cause a seizure. So how do they look? Well, the child would often be sick with an infection by the time the convulsions start. And the usual symptoms are loss of consciousness, convulsions, which is uncontrollable shaking, jerking, stiffening, or any sort of uncontrolled movement of the arms and legs, eye rolling, unconscious urination, bedwetting, or bowel movements, some drooling, or possibly vomiting, and characteristically fever, because all of these symptoms could be related to other types of seizures. The fever is what's going to make the differentiation here. So we have two different types. Simple really just refers to the duration of the seizure. If it lasts less than 15 minutes and occurs only once in 24 hours, then it is a simple febrile seizure, and it is the most common type. Otherwise, if it lasts longer than 15 minutes or if it occurs more than twice in 24 hours, then it is considered a complex seizure. Also, it may affect only one single part of the child's body, making it a complex seizure. Now, shorter seizures tend to not cause any long-term harm, whereas the longer ones may present some more damage in the brain tissue and may even increase the risk for development of epilepsy later in life, which we'll talk about later on. For the patients, how do they look like? Well, most of them are of young age, most likely 12 to 18 months, but can be anywhere from 6 months old to 5 years old. They might have a family history of febrile seizures, so it's important to ask the child's parents or representative if this is the case. Some of them will experience other symptoms, typically related to the illness that brought about this fever. And some of them might even have low body temperature prior to the first seizure, which sometimes is a bad prognosis, as it tends to indicate a higher chance of suffering more seizures during the episode. Well, how do we diagnose it? First of all, they're going to present in clinic with their parents who are going to be concerned about the seizure. And if you take the temperature, more than likely they will have a fever, or they would have had a fever before they were brought in. An MRI should be performed just to rule out any other potential causes for the seizures. And the ECG then is done to confirm the type of seizure and the location. And the treatment really is going to be focused on mitigating the fever to hopefully reduce the amount of seizures that the child would suffer and ensuring their safety during the episode of convulsions. This all is taken into account by giving acetaminophen or ibuprofen to lower the fever, laying the child on a safe place like the floor in order to prevent falls from the bed that would exacerbate the damage suffered to the child, laying the child on their side to prevent choking or suffocation, especially because vomiting is a known symptom, and seek immediate medical attention for the seizures. Take the time when they started, and then after the episode has been properly tended to, then contact the child's primary care physician in order to determine the etiology of the fever. Now, where do we stand today with febrile seizures in the literature? A paper presented by Lee et al. Proposes that prenatal exposure to a flu infection may be linked to febrile seizures in infancy. Another paper that I was able to find suggested that low levels of vitamin D in this blood serum may correlate with higher risk of febrile seizures in children with some illness that gave them a fever. Also, it is possible that the number and magnitude of febrile seizures may possibly correlate with later development of ADHD for the child, presented by Israel et al. And lastly, there was a mutation in a particular gene identified. This is gene ATP6V0C, and it has also been linked to higher risk of febrile seizures during episodes of fever. Thank you, and I look forward to presenting some more of this type of information.